Hi, this is Melanie Gray with a week 3 update for our community health course. First of all, I'd like to just give you an update, bring you back to our CLC, your group projects. As of today, really, your group should have selected a topic and you should have sent me an outline of what you guys were going to do related to your project. Kudos to the purple team who sent me an outline in PowerPoint form, and I believe the white team had an outline and it also started their CLC contract. So you guys are really on the move. I want to just really congratulate you because these next 3 weeks are going to pretty quickly. So going to go pretty quickly. So your goal is really to have your assignment to take this week and next week to really write your project, and then use your 5th week to merge it and edit it for submission. So you don't want to do your research to the last week if you can avoid it. It will really help you. So if you have any further questions, I'll look for them on the forum. I had a couple questions come in regarding the heritage assessment. Okay, this week's over the past couple weeks we've looked at the role of a professional nurse. We've in community health. We then looked at the we looked at education. The focus was on what teaching methods do you use, what do you have to understand about teaching and learning, because a great important role and aspect of the community health nurse is to do patient education, but not just on a um, individual level like you might do in acute care, but the community health nurse looks at family systems and then larger community systems, and they look at what are the methods that I can use to teach and educate larger systems, larger numbers of people and families to help improve their life or the quality of their life, or improve their knowledge so that they will have a greater level of health, uh, a greater level of health. So it's expanding what you already do as acute care nurses to a larger framework, looking at systems. So this particular assignment, the heritage assignment, or is looking at how would you do a cultural assessment, and why is that cultural assessment important, and that cultural awareness important to your role as a community nurse. So you'll see that the assignment calls for you to do to look at and really do the heritage assessment tool. And so you're going to take the heritage assessment yourself. And then you're going to interview 3 families from different cultures, and you're going to incorporate in your interview the questions from the heritage assessment, so that you're going to ultimately compare your own results culturally with and compare the results from the 3 different family cultures that you interview. In acute care, the Joint Commission, your accrediting and other accrediting bodies expect you, the nurse, to provide culturally sensitive care. Well, in community health, we're looking for the nurse to understand various cultures and cultural communities and culture within families to help those systems of individuals grow and again come to better health. So your goal then in this assignment is to you take the assessment and assess yourself, and then you're going to interview 3 other families from different cultures, and you're going to compare the differences in the health traditions. Now, I want to really emphasize the word compare, because in last week's assignment, you were to do a comparison of the articles, and some of you didn't do that, and so therefore your score was not as high as it could have been. So I want you to pay close attention to the assignment to compare and address the health traditions of these cultures, health maintenance, protection, and restoration, and identify common health traditions based on your cultural heritage. Evaluate and discuss how families subscribe to these traditions and practices. You're to do this in 1,000 to 1,500 words, and there is a rubric for this assignment, and the rubrics is here on your it can be found in the corner by the assignment. I really encourage you to review the rubrics so that you know how you're going to be scored, and so you meet all of the criteria to get the best grade possible. So again, in closing, we're looking at the ability of the community health nurse to understand heritage and culture, what meaning this brings to people, your patients, in terms of their health maintenance, protection, and restoration. So myself as African American, um, I have my heritage is of being African American. When I grew up, we ate all of the wrong foods, all the great fried foods, the grits and the butter and but I was taught to um, take good care of myself and maintain, medical visits with my physician. And I was encouraged to be involved in healthy practices like exercise. We just ate poorly, okay? But what I'm saying is you looking at nursing from an impact of culture on the decisions and choices that people make. Because until you understand that as a community health nurse, you are going to have more difficulty in reaching people, in touching them, in helping them understand. So I hope this helps. You make it a great day. Email me with any further questions, and thank you for your time.